Hello everyone, welcome to ACE Anesthesia. Today we'll be discussing the topic endotracheal tubes. As anesthesiologists, this is an important device which we use in everyday life. So it's very important for all of us to know about in detail. This video will be discussing regarding what is an endotracheal tube, the various parts of an endotracheal tube, the techniques of insertion, its complications, and also various confirmatory tests for confirming the presence of the endotracheal tube, and in brief regarding some special types of tubes. So let's start with what is an endotracheal tube. So an endotracheal tube is a device which is inserted into the larynx, through the larynx into the trachea for the delivery of gases and vapors into the lungs. Okay, it was William McEwen who first inserted like a metal rod into the trachea and delivered chloroform for giving anesthesia. So the parts of this endotracheal tube, right, can be divided into, so this diagram shows about the endotracheal tube. The various parts of an endotracheal tube consists of the patient end, which consists of basically the bevel, and there will be what is called as a Murphy's eye, right? Next we have the curve of this tube and various markings of the tube, the material of the tube, the size of the tube, the cuff and the inflation system, and the machine end of the tube. All these forms the parts of the endotracheal tube, which we will be seeing in detail one by one. Okay, first we will start with the patient end of the tube. The patient end of the tube is basically like a slanted portion, right, that is present at one end of the tube. The patient end of the tube basically has a slanted portion, and this slanted portion is called as the bevel of the tube. Bevel of the tube, we will see that it will be basically slanted. This forms an angle of about 38 plus or minus 10 degree with the body of the tube. Okay, this bevel is basically like a port for delivering of these gases, and also it facilitates the insertion of this endotracheal tube. So when we do a laryngoscopy, we push or swipe the tongue from right side of this mouth to the left. So we create a space on the right side of the mouth for insertion of this endotracheal tubes. The bevel facilitates and also helps to visualize the tube along its path. The another thing which we will observe in case of this is what is called as a Murphy's eye. Okay, called as Murphy's eye. So this is a small opening that is present on this opposite side of the bevel in the endotracheal tube. So this acts as an additional port for the ventilation in case if the bevel gets closed because of abutting against trachea or any foreign body, etc. But the disadvantages of the Murphy's eye is that it may clog in some secretions or foreign bodies, or the suction catheters or any bougies can get stuck in the Murphy's eye. And we will see that apart from this, certain tubes may not have this Murphy's eye. Those kind of tubes are called as the Magill's tubes. Okay, so we finished what is the parts in the patient end of the tube. Okay, next we come to the curvature of the tube. The curvature of the tube which is present, they will be usually having a radius of 140 plus or minus 20 millimeter. That is the radius of curvature of the circle of which the curve is a part is this much. So next we will be discussing regarding the markings which are present on the tube. Okay, so in the body of the tube there are several markings. First of all, in this it includes whether it is oral or nasal. These two things will be written on the tube itself. Okay, certain tubes are supposed to be put only orally or nasally. Next, we will see the size of the tube that may be often written on the endotracheal tubes. The size will be in millimeter or in French. Okay. Third thing which we will see written on the tube, which will be certain a radio opaque line. Okay. So this, because it's a two-dimension, it's not, I'll just draw a line. So there will be a radio opaque line which will be running across this entirety of this tube itself. Okay. So this entirety of the tube will have a radio opaque line, and this can be very well visualized in a chest X-ray. Okay, this line will help us to identify the position of the tube, whether we have properly placed it or not in an X-ray. We will have another line. This is the black line or marking. Okay, this is an indicator for us that it has crossed the cords. That is, this black line should be crossing the cords during the time of insertion of this endotracheal tube, which will help us in advocating how much of centimeter should have passed in the tube for proper positioning of the endotracheal tube in the patient. Okay, and after this, certain other things which may be written is, one is we have the depths of insertion. So this is at the level of incisors or at the level of this lip, wherever we are fixing, we see the markings that may be written on the endotracheal tube for us to identify till what depth we have inserted, and these will be at the level of incisors. Or if we are doing a nasal intubation, at the level of the nose, what is the depth of the tube which has been inserted. Okay. Apart from all these markings, we may have the wrapper of the tube containing written whether it is a single use or number of uses it is allowed after cleaning or after autoclaving. And the last one which we always see is some kind of the manufacturer's name, details, and also certain trademarks which may be written. Okay, like Confonte European. This may be written in certain of the European tubes that will tell us about the material of the tube, any allergic factors that may be associated with the tube because of the material of which the tube is made of. Okay, so we finished the curvature, we finished the markings. Next we come to the material of this tube. The material of the tube, it may be made up of rubber, or it may be made up of PVC, or it may be made up of silicone. Okay, the rubber which is present is usually latex kind. Patients may be often allergic to this. They are very hard and they do not soften very easily to the body temperature of the patient. So they are often reusable, they are washed and reused. So these in turn, these were the tubes that were used in the olden days. So they had increased chances of infections because of this. One more thing is that these rubber tubes have cuffs which are low volume, high pressure cuff. They will provide a good seal, but they often had increased chances of sore throat as well as increased chances of tracheal stenosis and scarring post intubation. Another type which we use is in our daily life, commonly used in the present generation, is the PVC tubes. They are single use tubes, they are transparent, they are allergy free, and the cuffs which are made up of are usually high volume and low pressure cuffs. So they do not cause much of post intubation tracheal stenosis or scarring. Another type is actually silicone type of tubes. They are basically polyurethane in which silicone oil is reinfused. They are not transparent, they are like rubberish white color, and they can be autoclaved and reused. And silicone tubes often soften very easily to the body temperature. After the material of this endotracheal tube, we will have the size of this endotracheal tube. So often we have seen earlier that the size of the endotracheal tube itself will be marked on the tube. They can also be sometimes marked on the pilot balloon also. Okay, in certain non-cuff tube, it will be towards the machine end that the naming or the numbers would have been written. So appropriate size of this endotracheal tube is very important for the well-being of the patient. Okay, so usual sizes which we use in males is 8 to 8.5 millimeter, and in case of females it is 7 to 7.5. So whatever we are saying is the size of this endotracheal tube is basically the internal diameter of it. Okay, an internal diameter, as I said earlier, it can be in the form of millimeter or it can be in form of a French gauge. Okay, the thing is, if the tubes are of size less than 6 millimeter of internal diameter, they usually mention most of them as external diameter, those tubes which are smaller than this. Okay, because they will provide higher resistance to the gas flows. So why selecting an appropriate size is very important, because if we select a large size tube than the usual or what is required for the patient, it will have increased incidences of sore throat, post-op. So whenever we have a bigger size tube, the cuff we may inflate it to a lesser extent than what should be actually done. So these may cause certain like leaks that may cause ventilator associated pneumonia in the later periods. Also, they will have increased chances of throat pain and all this affiliated to it. But what happens when we select a tube which is smaller than what the patient requirement is? This may lead to increased resistance to the gas flows, increased chances of kinking, dislocation, and also it will be very difficult to pass any suction catheters, fiber scopes through the smaller size tubes. So when we are discussing regarding the size of this endotracheal tube, especially the pediatric age group, it carries greater importance. Why? Because the narrowest part in children is actually the cricoid region, and whenever there is a circumferential edema, this reduces the lumen diameter by 10% in adults, but it is about 35% in case of children or the pediatric age group. So we have certain formulas which are to be followed when we are selecting this endotracheal tubes. So in pediatric age group, we usually have uncuffed tubes, okay? And if the age of the child is less than 6 years, then the size of the tube is age in years divided by 3 plus 3.5, okay? If it is more than 6 years, it is age in years divided by 4 plus 4.5. This is called as modified Cole formula. Okay, so this is the formula that is used in pediatric age group in case of uncuffed tubes. Okay, in often we have certain techniques like physically we can see the distal phalanx of the little finger. That size will be almost the size of the tube which will be required by the child. Okay, so this is in case of uncuffed tube. Usually cuffed tube will be about 0.5 to 1 millimeter internal diameter, smaller size we can take as compared to that of this uncuffed tubes. Especially in children like Down syndrome, they may have a narrower trachea. It's always better to go for a smaller size tube. So next we'll be discussing about the cuff and the inflation system. The cuff is something which will help us in providing a seal for the endotracheal tube against the trachea. The function of it is to prevent any gas leaks, to help to centralize the tube within the trachea, and also prevent aspiration of the pharyngeal contents into the trachea. Right? So the cuff system can be divided into two types. Okay, one is the low volume high pressure cuff or high volume low pressure cuff. Okay, so the low volume high pressure cuff and high volume low pressure cuff, these are the two types of the cuff system. So in low volume high pressure cuff, this cuff is basically made up of either rubber or like latex, and this will be requiring very high pressure to inflate the cuff. Their compliance is very low. These cuffs which will be providing actually a good seal with the trachea, but unfortunately because of the high pressure, they have increased chances of causing ischemia to the trachea. That is, the capillary pressure will be overcome with the pressure that is caused by the cuff on the trachea, causing tracheal scarring and tracheal stenosis. So in this low volume high pressure cuff, if we consider this as the trachea, it inflates in a circular manner. Okay, so this cuff will be inflating in a circular manner, with the area of contact to the trachea will also be very less. So this kind of cuff actually causes lesser incidence of sore throat, but since the area is very small, the pressure is very high, it may cause overcoming of this capillary filling pressure of the trachea, causing tracheal scarring and tracheal stenosis. Okay. Next, coming to another type, that is the high volume low pressure cuff. High volume low pressure cuff is basically of our modern endotracheal tubes which we use, made up of polyurethane. They require higher volume for inflation. Their compliance is very high, and also these cuffs expand by expansion of certain gases like nitrous if we use along with them. So the cuff inflation pattern will be having a greater surface area of contact with the trachea. So when we see, these cuffs will inflate in such a manner that the surface area with the tracheal wall will be more. So pressure exerted that is present on the trachea will be less. So they will have the advantage is that they will have lesser incidence of tracheal scarring and stenosis. But the disadvantage is that there may be certain spaces that is left in between these cuffs which may trickle down, causing ventilator associated pneumonia. So this is seen in case of this our polyurethane foam cuffs which are present. That is, a PVC tubes usually contains these kind of high volume low pressure cuff. So when we come to cuff, the standard cuff pressure is about 18 to 25 millimeter mercury. So this is the cuff pressure which can be monitored with a cuff pressure manometer. So this foam cuff basically provides a larger surface area. Since it's a polyurethane foam, whenever we apply like a negative pressure or suction, it causes the foam to shrink, and once the negative suction pressure is released, the foam will expand. So this is a specialty, one different type of cuff which we see in certain endotracheal tubes. Next comes another type of tube, another type of cuff which is called as the lance cuff. So this lance cuff system that is present contains basically like a latex sheath. Okay, the latex sheath is, or the latex is the pilot balloon that will be covered with a transparent sheath. Okay, so this one will be a pilot balloon. Okay, and this will be a transparent sheet around it. Okay, this will be attached with this inflation system. So whenever we will be putting in this air for the pilot balloon, preferentially it will be this rubber one which will get inflated, and this will neutralize with the pressure of this outer sheet. So what is the advantage of this type of cuff is that whenever we try to overinflate, the excess pressure will get somewhat balanced by the outer sheet. So this pilot balloon keeps on inflating till it almost touches the transparent sheet, and that's when the pressure is equalized by this. So this also in a way help us to prevent overinflating the cuff. So this is another type of the lance cuff, is another type of special cuff which is present in certain types of tubes. The inflation system. So the cuff is always associated with an inflation system. This consists of like a small tubing that goes along the length of this endotracheal tube, and that gets connected to, this is called as the pilot balloon. Okay, so this is the inflation system with the pilot balloon. Pilot balloon often sometimes measures the size of the endotracheal tube, is also mentioned on it. And the pilot balloon also contains like a valve. This valve is through which we inject the air from the syringe into this pilot balloon. The valve that is present in this usually contains like a spring, which is a one-way valve that goes into this pilot balloon. Okay, so when we inject the air, this spring is pushed forward and the air basically goes into the pilot balloon. Okay, when the syringe is pushed out or it's removed, the spring closes the nozzle back, so it prevents the leak of the gases from the pilot balloon into this outside world. Okay, so if we have to remove the air from the pilot balloon and in turn from the cuff system, we have to insert a syringe and then put a negative suction pressure. Okay, that's the way that we remove the air from this pilot balloons or from the cuff system. So in case if we notice that we don't have a syringe for an emergency, and quicker alternative which may also help us in removing the gas from the cuff is by cutting this inflation system itself. Though the release of the gas is quite slow compared to it, but it will help us in certain emergencies.